Hello, I'm Dr. Brett Phillips, and I'm going to show you a demo on how I fill my syringe with my neural therapy solution. Again, neural therapy could be used for segmental therapy, trigger points, scars, ganglia, and that will really determine what sort of gauge and size of syringe we put on at the end. So first and foremost, I always like to make sure my vials are nice and clean. You know, I use a 70% alcohol solution, and you want to let that dry before you put a needle into there. I almost always like to use a 10 cc syringe, and I like to use a 1% procaine for my neural. Often, but not always, I may put in a methylcobalamin. So, as that's drying, I'm going to get our 10 cc syringe open. You always want to open it from the flaps, just like so. And then for my draw needle, I like to use a 20 gauge 1 inch, just like all the other times I fill for the different regenerative injections. Again, just a reminder, you want to open it from its flaps, just like that, to keep it nice and sterile. Attach that on there. Now I just take a look. Yep, things are dry. So I select my 1% procaine, put a little air into the bottle so it's not vacuum sealed, draw up that solution. There we go. So I will put in as much as necessary, or I think I'll need for the treatment, and that may also determine if I use a 5 cc or a 3 cc if I'm doing, a smaller part of the body. Then I like to take my methylcobalamin, again, draw that up. Gives it a nice little pink hue. Then discard the draw needle into the sharps. And then select which needle is appropriate for the neural therapy treatment I'm going to do. So let's say I'm going to do a nice little scar. I like to use a 27 gauge for scars, a 1 1/4 inch. So again, I open it from its flaps, attach it on there, and neural therapy solution ready to go. Now, you may notice that I have some other syringes over here because from the other demos I was filling up. One of the things that I like to think about is if I'm filling up a lot of syringes, especially at the beginning of my day, I don't want to forget which one's prolotherapy, perineural therapy, or neural therapy. So often I will use my black little jiffy, and I might write right on here 25%, and then a little, Prolo on there. Here, this one was my 15% Prolo solution. That's important because if you look, it's very hard to distinguish sometimes the difference between your Prolo solution and your neural therapy solution. So for neural therapy, I like to just put a little NT. And then for perineural, I'll put a little PN. This becomes quite important when you're filling lots of syringes, as what happens is if you don't do something like that and you set them all down, what happens is you don't know what's what, and then it's waste product. You have to discard of that and start all over again. So, thank you for joining me.